Have you ever wondered why some people seemingly happy and content on the outside struggle with a hidden battle on the inside? This silent struggle is often the face of depression, a common but potentially severe mood disorder. It's like an unwelcome guest settling into the corners of one's mind, casting a shadow over their thoughts, feelings, and even their ability to carry out day-to-day activities. Depression is not a fleeting emotion. It's not just a case of the blues or a temporary response to life's challenges. It is a persistent condition that lingers, often interfering with a person's ability to function normally. It can make the simplest tasks seem insurmountable, and the brightest moments appear dim. Imagine feeling perpetually shrouded in a fog of sadness or indifference, where joy seems elusive and even the most vibrant colors seem dull. That's the reality for those battling depression. It's not something they can simply snap out of or shake off. It's a relentless struggle, a constant tug-of-war with their own thoughts and feelings. Depression is not a one-size-fits-all condition. It manifests differently in everyone, making it even more challenging to understand and recognize. For some, it's an unshakable sense of sadness and hopelessness. For others, it's a profound emptiness or a feeling of disconnect. It can be an overwhelming sense of fatigue or a loss of interest in activities once enjoyed. Depression is not a choice. It's not a sign of weakness or a character flaw. It's a serious mental health condition that requires understanding, compassion, and medical care. Just like any other health issue, it needs to be addressed and treated. Depression is a hidden battle. It's a silent struggle, but it's a battle that can be fought and a struggle that can be overcome. It starts with understanding that depression is not simply feeling sad, it's much more complex than that. Depression is not a sign of weakness or a character flaw. It's a medical condition just like any other health issue. Depression often goes unrecognized because its symptoms are not always what you might expect. It's easy to misinterpret it as just feeling blue or having a bad day. But depression is much more than that. It is a serious mental health condition that can affect every aspect of a person's life. So, what does depression look like? Well, one of the most common signs is a persistent feeling of sadness. This isn't the same as the temporary sadness you might feel after a disappointing event. It's a constant, heavy feeling that doesn't lift, even when things seem to be going well. Alongside this sadness, people with depression often experience feelings of hopelessness or pessimism. They may believe that things will never get better, or that they're doomed to feel this way forever. This can be an incredibly isolating feeling, and it's a big part of why depression is such a difficult condition to live with. Depression can also manifest physically. Many people with depression report feeling constantly tired or lacking energy. They might struggle to get out of bed in the morning or find it hard to summon the energy to do even simple tasks. Sleep can be affected too. Some people with depression find themselves sleeping too much, while others struggle to get to sleep at all. Either way, disrupted sleep can make the other symptoms of depression even harder to handle. Possibly the most alarming symptom of depression is having thoughts of death or suicide. If you or someone you know is experiencing these thoughts, it's crucial to seek help immediately. Remember, it's okay to reach out and ask for support. Keep in mind that these symptoms must be present for at least 2 weeks to be considered clinical depression. However, everyone experiences these symptoms differently, and they can vary in intensity. Some people might have a few of these symptoms, while others might have all of them. Depression affects everyone differently, so symptoms can vary widely from person to person. It's a complex condition, but understanding its signs is the first step towards seeking help and starting on the path to recovery. Imagine carrying a weight so heavy, yet so invisible, every single day. Depression can often feel like this, like an unseen anchor pulling you down. It's not just about feeling down or sad. It's a complex, pervasive condition that affects every aspect of a person's life, from their relationships to their job and even their physical health. Living with depression can be like trying to navigate through a fog. Everything seems muted, distant, and difficult to engage with. The things you once loved, the activities that used to bring you joy, they all seem colorless, tasteless. It's as if a gray film has been laid over your world, draining it of its vibrancy. And it's not just the emotional and mental toll that depression takes. Relationships can suffer too. It's hard to connect with others when you're wrestling with an internal storm. You might find yourself withdrawing, isolating, creating a chasm between you and the people who care about you. This can leave you feeling even more alone, exacerbating the feelings of sadness and despair. In the workplace, depression can be a silent saboteur. It can sap your energy, dull your focus, and leave you feeling overwhelmed by tasks that once seemed manageable. You might find it hard to get up in the morning, to face another day of trying to keep the mask in place, of trying to pretend that everything is okay. And let's not forget the physical toll. Depression isn't just a mental health issue, it's a whole body issue. You might find yourself feeling constantly tired, having trouble sleeping, or experiencing changes in your appetite. Your body might ache in places you didn't know could ache. You see, depression doesn't just affect the mind, it also affects the body. Depression is a heavy burden to bear. But remember, it's okay to reach out, to seek help. It's okay to say, "I'm not okay," because living with depression is hard, and no one should have to face it alone. Depression doesn't just affect the mind, it also affects the body. Reaching out for help is not an admission of weakness, but a step towards recovery. When depression grips, it's often difficult to see the way out. But remember, there's always help available. Seeking assistance is an integral part of the healing process. It's about acknowledging that you are human, that you have limits, and that it's okay to lean on others when the going gets tough. Depression isn't something to be battled alone. There are healthcare professionals who are trained to help. Psychiatrists, psychologists, therapists, and counselors are equipped with the knowledge and skills to guide you through your journey to recovery. These professionals can provide a diagnosis, offer treatment options, and provide a safe and supportive environment for you to express your thoughts and feelings. The treatment for depression is multifaceted. It can involve therapy, medication, lifestyle changes, and support from loved ones. Let's delve into these a bit. Therapy, specifically cognitive behavioral therapy or interpersonal therapy, can be incredibly beneficial. It helps you recognize and change thought patterns that lead to depressive feelings. Medication, such as antidepressants, can also be an effective treatment option. These drugs can help improve mood, sleep, appetite, and concentration. Yet it's important to remember that they're not a cure-all. They work best when used in conjunction with other forms of treatment. Lifestyle changes like regular physical activity, a healthy diet, adequate sleep, and reducing alcohol intake can significantly improve your mood and energy levels. Lastly, never underestimate the power of a support system. Loved ones can provide emotional support, assist with daily tasks, and encourage you to stick with your treatment plan. They can be a beacon of hope in your darkest hours. It's essential to remember that everyone's journey with depression is unique. What works for one person might not work for another. It's all about finding what works best for you, and that begins with reaching out. Remember, it's okay to ask for help. You are not alone. Let's summarize what we've learned about depression. It's not just a case of the blues or a sign of personal weakness. It's a complex mental health disorder that can affect anyone at any time, and it's as real as any physical ailment. Depression is more than just feelings of sadness. It's a persistent, pervasive sense of despair that interferes with your ability to function and enjoy life. From loss of interest in activities you once loved, to changes in appetite, to feelings of worthlessness or guilt, it has a multitude of symptoms that can vary from person to person. It's crucial to remember that depression is not a character flaw or a sign of weakness. It does not discriminate and can affect anyone, regardless of age, gender, or socioeconomic status. It's a complex interplay of genetic, biological, environmental, and psychological factors. Living with depression can be challenging, but it's important to understand that it's not a life sentence. There are numerous effective treatments available, from medication to psychotherapy and lifestyle changes. Each person is unique, and what works for one might not work for another. It's all about finding the right approach that works for you. Seeking help is a vital step. It takes courage to reach out, but remember, you're not alone. From healthcare professionals to supportive loved ones, there are people ready and willing to help. Don't hesitate to reach out to a mental health professional if you or someone you know is struggling. Depression is a serious health condition, but there is hope. With the right support and treatment, you can manage your symptoms, regain control, and lead a fulfilling life. Always remember, it's okay to ask for help. It's okay to lean on others. Depression is not a battle to be fought alone. There is help. There is hope. You are stronger than you think.